Right. Let me ask the same question that I have asked to Tobian. I mean, do you usually remove the vaginal wall in an anterior rectal, low rectal tumor?
No, I think that in many ways is something that was always in the surgical textbooks about abdominoperineal in the female, but I think if the cancer is other than anterior, and even if it is anterior, if the bimanual examination, when I say bimanual, I mean vaginal and rectal, performed on the table before, preferably before you put the patient to sleep, but certainly at the latest on the table before you start operating. If the cancer is freely mobile on the posterior vaginal wall, I think that's a little bit of mutilation of the female that we don't have to do anymore. And in most cases, I would try to preserve the posterior vaginal wall, or at the very least the posterior vaginal mucosa, which sometimes one can get into the plane which just leaves the whole circumference of the vaginal mucosa intact, whilst perhaps the trouble is that plane bleeds. There are veins there, but I think it's a pity to take out the posterior vaginal wall unnecessarily.